Getting good images of the vessels and accurately diagnosing disturbances of blood flow in the veins depends on setting up the ultrasound equipment correctly. In this episode, Michelle Moore discusses ultrasound transducer frequency and its relation to penetration and resolution for image optimization, and she discusses pulse wave settings for detecting blood flow. If you would like to have a transcript of this video with explanatory notes, please send me an email. The address is below and it is repeated at the end of this episode. Please be sure to state which episode notes you wish to receive.
Most ultrasound machines arrive with preset factory settings. Selecting the venous option in the transducer option menu should give you a good starting point. Probe preset you can select using the trackball. We've got a linear transducer and that selects. So you can see by the screen that we're starting at a frequency of 6.6 megahertz, which is suitable for venous work. This probe is a multi-frequency probe and this goes from 10 megahertz and this is reducible down to 3.5 megahertz. The lower the frequency, the more penetration. Therefore, you're going to need a lower frequency for looking at the deeper veins. The higher frequency is going to give you more spatial resolution, which is always important, looking at the more superficial structures, but there's a trade-off between the deep penetration and the quality of the image. We're going to start with a frequency of 10 megahertz. You can see a transducer in a transverse position. On the screen, this equates to the front of the patient, the back of the patient, the right and the left. Turning the transducer 90 degrees into a longitudinal position. This now reflects the patient's head, feet, front and back. Starting in transverse position, you can identify the vein. In this instance, looking at the carotid artery. To optimize the image further, you can use your depth selection. This makes the image easier to see more superficial structures. Also, it takes the eye away from these deeper structures that are irrelevant at the time of the scan. So here we are in the longitudinal position. And then back into the transverse position. Focal zones, usually preset with one focal zone. This can be manipulated either using a focal zone on the keypad or in this instance using the trackball. The focal zone needs to be placed at the point of interest and that will give you the most information returning back from the probe and produce a better image. To select a vascular setting, a colour flow mode. So we can see, obviously with the carotid artery, we have plenty of vessel fill. For a venous setting, the PRF should be at 1000 Hz or lower. The PRF also referred to as scale or flow rate, and this can be again manipulated using the keys on the keypad. The lower the PRF, the slower velocity of blood to be picked up within the vessel. To optimise the visualisation of the colour flow within the vessel, the colour flow box needs to be angled so that it matches the vessel walls. This is done by the steer key. If you were not achieving full vessel fill, we could increase the overall colour gain, again using the keypads. If you got to get aliasing, flow around the outside of the vessel, reduce the colour flow. To an optimum level. The pulse wave setting again needs to be angled to the level of the vessels. Placing the pulse wave in the centre of the vessel prevents any disturbance from the vessel walls. The sample volume is the little box inside the pulse wave, and this needs to be selected to the appropriateness of the vessel size, which again can be done by manipulating on the keypad, making it larger or smaller. And again, the Doppler trace can be increased as an overall gain and reduced as appropriate. To return back to the normal mode, select the B mode code and you're back in grayscale. To optimise the grayscale image further, you may want to reduce the overall gain. This reduces all of the echoes returning back from the probe, or you may want to increase the overall gain, and that amplifies all the echoes returning from the probe. We can also alter the level of the echoes at various points throughout the picture using our time gain compensator, which is the slidey keypad on the console. And what this does is, if you're having trouble visualising the deeper structures, we can increase the image by amplifying the echoes returning from the depth by altering the time gain compensator. And this can do this at various points throughout on the screen. If we just show you how that can happen just by setting it up a bit extreme and then returning back to normal in the centre. So the importance of correct flow settings within a vessel can lead to misdiagnosis. If you have your frequency or your flow rate set too high, there'll be no fill within the vessel, and this may lead to misinterpretation of a blocked vessel in the case of a DVT or blocked artery, and therefore essential to keep the velocities at what would be expected for a venous or arterial study. For venous studies, you would need to be at 1000 Hertz and below, and always just try to reduce the flow rate or pulse repetition frequency to ensure there's no flow within a vessel suspected to be occluded.